Good morning. Pleased to be joined by Mayor Darrell Steinberg of the great city of Sacramento, along with the police chief of the Sacramento Police Department, Daniel Hahn. Important announcement today, and you can see some of what we've got to talk about here today. This week, we will be preparing for National Prescription Drug Take-Back Day this coming Saturday, the 27th of October. This will be the second take-back day that we have this year in 2018, and it's critical. It's critical that we get the media to help us communicate to the citizenry how important it is that we do everything we can to help combat the use of illegal use of medications, and of course that we help avoid the accidental use of medications, especially by our children. And so we want to thank all of you who are here today to help us spread the word that we all can do something to tackle this problem. This is something in terms of prescription medication and its use and abuse that I think each of the three of us can speak to in terms of the work that we do and how important it is to try to tackle the problem of misuse or accidental use of prescription medication. Drug overdoses in this country kill more than 63,000 people. At least that's the number from 2016. Drug overdoses in this country, 63,000. Nearly two-thirds of these deaths involved a prescription or opioids. This is an epidemic with a major challenge for all of us, and certainly for those of us in law enforcement. But it's a challenge that really must be put to the people, to the families that have some of these prescriptions in their homes, that have children who could access these prescription medications in their homes. We all have a role to play. The Department of Justice, law enforcement statewide cannot tackle this problem and this epidemic alone. And quite honestly, law enforcement cannot arrest its way out of this crisis. It takes a team effort, and that's why we're here today. At the California Department of Justice, we investigate and prosecute prescribers who overprescribe prescription drugs, including opioids. Our Bureau of Medi-Cal Fraud and Elder Abuse combats prescription drug fraud against our seniors in this state. In April, for example, we charged Dr. Satandra Kumar Chopra, a Modesto physician, for inappropriately prescribing opioids to Californians throughout the state. He may have been based in Modesto, but he was prescribing to people from throughout the state of California. We partnered with the U.S. Attorney's Office to investigate this doctor and to bring charges. In addition, California is one of 45 states nationwide involved in what we call a multi-state investigation into major companies that manufacture, distribute, and sell opioids to find out if they were breaking the law. It involves companies like Purdue Pharma, Endo, Janssen, Teva, Cellophane, Allergan, and others. At the California Department of Justice, we also administer the Cures database, a statewide prescription drug monitoring program that helps cut down on doctor shopping by individuals seeking drugs and overprescribing practices by physicians themselves. The database has been up and running for prescribers, for pharmacists, and law enforcement. As of October 2nd, however, it is now mandatory for prescribers to use the Cures database. There are some powerful tools that I've just mentioned that we can all use, whether it's our legal tools to take companies to court, or whether it's the Cures database system, or it's simply making sure we're tracking people who have the right to prescribe medication. Law enforcement can do quite a bit. But the most powerful tool that we have is our fellow citizens, and our fellow citizens working with us to dispose of prescription drugs that are no longer needed, that are outdated, that could be a harm to family members if they continue to stay within reach of individuals, including our children. Leftover, unused, or old medications can be deadly in the wrong hands. Imagine your young child swallowing a pill meant for an adult. We also know that flushing these medications down the toilet can be poisonous to our waterways, and needles thrown in the trash can not only injure, but might also kill innocent individuals. That's why National Prescription Drug Take Back Day, coming up this Saturday, the 27th, is so important. We thank all those leaders who are taking steps throughout California in all of our communities, and certainly here in Sacramento, to make sure that we have safe disposal sites where people throughout our communities can anonymously return their unused medications. We list some of those here on these charts. And at our last prescription drug take-back event in April, we set up 318 collection sites throughout the state of California. During that campaign, we collected nearly 67,000 pounds of drugs in California alone. And throughout the nation, the number was close to 1 million pounds. It's an important tool, and it's a big step in this ongoing fight against prescription drug abuse. I hope all of you will join in this effort to make sure that we preserve a life, we save our child, we make sure that we use prescription drugs safely and legally. With that, let me now turn it over to our mayor from Sacramento, Darrell Steinberg.
Thank you, Mr. Attorney General. Thank you, Chief Hahn. It's good to be with you today for really a very sobering but important announcement. This is the terrible epidemic of our time. This opioid crisis. I know it's hitting a lot of other parts of the country in very significant ways as well, but here in Sacramento, when we look at the changing nature, for example, of our homeless problem and the numbers of people on the street, yes, it involves high housing costs and untreated mental illness, of course, but the change now is that more and more people are addicted to drugs in a very serious way. And though it's not all opioid, a lot of it is. And it starts, 6.2 million people in the country using drugs in an inappropriate way. And the way it happens, of course, it's the leftovers from a family member where it's been prescribed appropriately, but somebody who it hasn't been prescribed to ends up taking it and using it, and that begins oftentimes the cycle of addiction. And this happens again and again and again. And sometimes, the most important ideas are the common sense ideas. This idea of being able to safely dispose of these drugs is really, really important. And in April of 2018, as the Attorney General alluded to, here in Sacramento, we collected 560 pounds of leftover unused drugs that would have ended up potentially in the hands of people who shouldn't be taking them. And so we're doing it again, and the chief is going to talk in a moment about the number of available sites we have for people. This should be easy to do, convenient, just like voting now, to be able to hand over what you don't need and keep these drugs out of the hands of people who don't need them, and oftentimes who end up in very, very bad states. We can do better, and this is an important step. Thank you so much for having me. Appreciate it. Chief Hahn?
Thank you, Mayor. I first want to thank Attorney General Becerra for partnering with the police department and the city on this important issue, along with the mayor, who's also here today. Our department, Sacramento Police Department, participated in this for several years now, and it's important issue in our city and across the country, as drugs not only destroy lives but lead to crime and many other things that really tear at the quality of life in our cities. And so one of the issues is prescription medications that leads to addiction of prescription meds, and also oftentimes leads to addiction to street drugs. Just imagine you had surgery on your knee and you're prescribed prescription medication. If you're like most people, you probably don't take the whole prescription because your knee stops hurting after a couple days. And I would challenge you right now to look in your medicine cabinets and tell me how many pills are in that prescription bottle. So if your kids or somebody had friends over and they used the restroom and looked through your medicine cabinet and take a couple of those pills, you probably wouldn't even notice they were gone. And so it's very important that our families, our folks in our city turn these medications in once they're done using them. So as the Attorney General said, none of your children get a hold of them, but also people that are building their addiction to them also can't get a hold of them. And so we have this Saturday is Drug Take Back Day, and we hope as many people as possible can come and just drop off their medications. There's no questions asked. They just drop it in there because it's really important for us to get these out of our houses and out of our communities so they can't be used by people that are building an addiction to them. You can do that this Saturday from 10 to 1 or 10 to 2 at our police headquarters, which is at 5770 Freeport Boulevard. But also, if you can't for some reason make it this Saturday, which we really hope that as many people as possible can make it this Saturday, but if you can't, we accept these in bins at that same location on Freeport Boulevard every day of the week, and also at our North Police Facility at 3550 Marysville Boulevard. People can come in and just drop them in a bin, no questions asked. There's nobody there asking you questions. Just drop them off, and so we can get these off our street. Because the best possible scenario for leftover prescription meds are that you drop them in bins. And every community across this country pretty much has locations. So if you live in a different city, I would recommend you contact your police department and find out the location of those bins, because it's much safer than, as the Attorney General and the Mayor stated, than flushing it down the toilet or putting it in the trash, because those things end up in places that we don't want them. So thank you for all those who are going to turn in their prescription medications that they're not using anymore this Saturday and every day of the week the rest of the year.